Okay, at the Alzheimer's Association conference, we have joining us Donna Wilcock. She is with the University of Kentucky, a doctor studying the role of both inflammation and the vascular system and how it relates back to dementia. Thanks very much for joining me.
Thank you for having me.
So let's just first start with all of the talk around inflammation. A lot of researchers looking towards inflammation to see whether it will unlock the key to solving what causes dementia.
Yes.
Talk to us a little bit about the role that inflammation plays and why it's such an important piece to research.
When we talk about the brain and inflammation, what we're talking about is there's specialized immune cells that live in the brain, and they're there to make sure that nothing bad happens. When they detect foreign material, and some of the changes we see in Alzheimer's disease are recognized as being foreign by these cells, they produce chemicals, what we call cytokines, chemokines, and these are to signal to try and make everything better again. And these chemicals signal and can cause damage. They can also be very good. They can help to get rid of those bad things that are happening in the brain, like plaques and tangles. We know that if you drive these cells in a certain way, they'll actually remove the plaque, which is a good thing. But you don't want that to happen and also have them releasing chemicals that are going to injure the nerve cells.
So why not take an anti-inflammatory? Would it work to stop the bad things from happening inside the brain?
So I think if you go back 15 years, there were a lot of studies, population studies, that saw a link between patients who used NSAIDs, so non-steroidal anti-inflammatory drugs like your ibuprofen or your paracetamol, that were using these daily, potentially for their arthritis or other conditions. There was a link between those patients potentially being protected from developing dementia later in life. And there was a lot of excitement about this because we did know that there was an inflammatory process in the brain. And so there was a clinical trial done, and that clinical trial had to be stopped. There was really no efficacy, and in some patients actually it seemed to make them worse. So now what the field is trying to do is to actually try and, instead of blocking inflammation, is trying to find a way to modulate and tune the inflammation so that we can have the good without the bad.
Right. Okay, and so a lot of your research is focusing on both the inflammation component as well as how the vascular system relates to the whole brain and system. So tell us a little bit about what specifically you're what piece of the puzzle you're looking to solve.
So now the issue really has become that we need to focus on the patient, and a lot of our sporadic Alzheimer's disease patients, meaning people who are over 65 who are being diagnosed with Alzheimer's, a lot of them are going to have some changes to their blood vessels too. And that can independently change the way the brain functions. So taking that view then, we want to know how those blood vessel changes affect the Alzheimer's disease itself, so the plaques and the tangles of Alzheimer's disease, but also how it affects memory performance. Because it may not be sufficient in a large number of patients to simply attack the plaques and the tangles. You may have to also address other things that are affecting the way the brain functions. And we think the blood vessels are one of those things.
There's been a lot of talk around food and certain, like for example, everyone should eat their blueberries, anything with dark purple pigmentation. Yes. The reason for that is I think research has proven it's linked to pigmentation called anthocyanin, and that is supposedly a very good way to improve blood vessel health. So my question to you as a scientific researcher is there truth around the role that food plays in terms of brain health?
Yes, no, absolutely there is. There's more and more studies coming out now that are controlled, large-scale studies looking at diet. Mediterranean diet, for example, has been getting a lot of press. And I think we actually think as a field now that a lot of that relates to not necessarily the Alzheimer's changes, but the vessel changes. And so now the brain can cope with the Alzheimer's changes for a longer period of time before that person becomes demented. So it's a way of kind of increasing your brain's resilience to what's happening to it. So I think there's a big room for diet. Certainly antioxidants. We know that oxidative stress in the blood vessels, it's linked to atherosclerosis. So that's why you're always told to do this when you have a heart attack and when you or a stroke. So it's the same thing. This is a way of kind of protecting your blood vessels from what you throw at it daily. And so I think, yes, there is definitely, and it's a change that we can all make.
And vitamin levels, right?
Yeah, so one of the things we've been studying is something called hyperhomocystinemia. And what that is elevated levels of this amino acid homocysteine in the blood. As many as 40% of people over the age of 80 potentially have high levels of homocysteine. It's not really been systematically studied on a population level, but in certain studies that's the number that's been seen. The major cause of that is to have deficiency in B vitamins.
B12 or just B?
B12, B6.
B12, B6.
Folic acid. All of those are needed to regulate the levels of homocysteine. And so if you eliminate those B vitamins in your diet, some people also have a genetic mutation that causes them to get increased homocysteine. That's rarer than the dietary B vitamin deficiency. But we've seen that when we induce this in our mice, we see big changes in the blood vessels in the brain, and we see memory loss. And so now, yes, we're considering homocysteine as being one of these other kind of modifiable risk factors, and modifiable by increasing your B vitamin intake.
Great. Okay, thank you so much.
Thank you.
That was good. That was really helpful.